Hello and welcome back to the Yodo channel. This is where we talk about some difficult healthcare topics and serious illness-related issues in a comfortable environment that is less stressful. Today I want to discuss selecting a hospice agency. This is a thorough review and likely way more information than you need. As you listen, there will be some suggestions that stand out and other ideas that are not a priority for you. If you're watching this because you're needing a hospice agency, please know that I'm concerned for your journey, the one that lies ahead of you and your family, and I want to give you an inside edge on how to evaluate a hospice service provider. Accepting hospice is scary. Picking an agency is a big decision. I want to provide information to educate and reassure you, and I hope what you learn will actually reduce some of your stress. You're going to see how these companies are set to a really high standard. What we're going to talk about today are some considerations you might keep in mind when selecting an agency, and many things that are taken care of for you. Questions you might ask when speaking with their admission personnel. I want to tell you about data that these different vendors all have to provide to the insurance companies and how they're graded on their quality. That their quality is linked to their reimbursement, and you can access a lot of this on the internet. For sure, know that you are not stuck with a particular agency. If for some reason you're not pleased with them or the service that they provide, you're not under any obligation to continue to use them. I want to arm you with thoughts that you might consider when you're making your decision about which agency you're going to allow to provide that assistance, and remind you of requirements that all agencies must fulfill that you really don't need to be concerned about or look up, but just know that they have to fulfill these obligations. In other videos, we've discussed eligibility for service, what hospice can do, the disciplines that they employ to provide that help for you, and how they're paid. So I'm not going to review that information in detail here, but there are some basic caveats I do want to cover. Being informed of eligibility is devastating to hear. As we've discussed before, it indicates that life expectancy is more likely than not 6 months or less if a disease process follows its current anticipated trajectory. Sometimes the information is a surprise, other times it's expected. There are a wide range of emotions that are involved. Some might worry more or be angry. Sometimes people feel like this is it, this is the end. And yet there are times when that's not the case. Some patients and families look through a different lens at this information. Learning that paid care is going to come to them to provide help from so many different healthcare disciplines gives them inner peace as they embrace the offer for that help that hospice can provide. Some are reassured to know that there's help there for them. Being eligible empowers patients to access the depth and comprehensiveness of hospice services to assist with providing care and symptom management. You're not required to accept hospice services. Once eligibility has been authorized, you've discussed the philosophy of comfort-focused care with your physician, and you're ready to learn more about this level of care, you can begin the process to evaluate the agencies. Gather some information, and then you can make your choice in a thoughtful manner. This can be done in just a few days or as quickly as in a few hours. Hospices are accustomed to working under time constraints. For those deemed eligible, they are encouraged to accept hospice services earlier. Studies reveal that patients that accept hospice services earlier often outlive that 6-month life expectancy. They report higher quality of life and improved symptom management. Studies, on the contrary, also indicate that when hospice is accepted closer to the end of life, patients and families report higher stress, more anxiety and fear, and greater suffering. Your primary physician or specialist might have suggested an agency to you, but you're not required to use that one. You do have the right to shop around. If the patient is living in a facility rather than a private home, the facility may have a list of preferred providers, and this can make your selection process a little bit less burdensome. They're watching out for your rights, and they can help ensure your access to timely and high-quality care. High priority for many is to inquire about insurance or billing. It's rare for a hospice agency to not accept a particular insurance, but it could happen. Address your concerns about payment for services by your insurance, and is there a copay for the service or medications that require a copay? Ensure that you don't have a restrictive insurance that doesn't allow for hospice service. That would be very rare, but if it's true for you, possibly you should consider a different insurance company. I think it's totally unacceptable for any insurance not to provide hospice care. Unfortunately, possibly due to changes from the healthcare industry itself, or maybe from managed care concerns like accountable care organizations or health maintenance organizations, they may require you to stay within a certain system. You can still fire a physician or a hospital system, or even the insurance company themselves for that matter, but you may have to wait for open enrollment. Health insurance companies seem to have prioritized making money now and not necessarily making you feel like they're providing the care or paying for the benefits that you want. A common concern for hospice dissatisfaction is a misalignment of goals. And to prevent that from happening, ensure that you're listening to what they are trying to tell you. Certainly it may not be what you want to hear, or you may not want to accept it, but please allow for truth and honesty to be given to you. Thus, evaluating the agency and ensuring early on that there's a good match of goals of care of the patient and the services that the company can provide, that will go a long way to reducing considerable frustration later. Remember, you do not need to go to the agency. They come to where you live. Thus, for many patients and families, it really doesn't matter where the physical office of that hospice is. So that's really not part of your equation. What you might ask instead is about the availability of an inpatient unit or an IPU. Sometimes care needs increase. Changes can occur, and the care can no longer be provided in the home environment. How will the hospice agency help? Ask about the availability and location of a hospice inpatient unit. The IPU and that level of care are discussed in more detail in a different video. For now, I just want to remind you that that is a higher level of care, and it's provided in a building where there's hospice staff present 24 hours a day, and the patient is visited by the physician or nurse practitioner daily to manage those acute symptoms. Agencies already staff multiple disciplines: nurses, aides, social workers, chaplain, nurse practitioner, and physicians. These employees are required to be available to visit and provide services, so you really don't need to ask about those. You might check on access for urgent needs and the timeliness of response after 5 p.m. or weekends. Don't forget, that's part of the service that you get. They will tell you how often the staff comes for routine visits and how to reach them after hours. Ask about symptom management, medications that will be provided. Make sure that the nursing discipline is going to provide assistance with setting up your med planner and counting of the medications, which medications they will provide, and would they plan to stop any of your current medications. They should give you a thorough review and discuss the value and risks of all of your medications. They will provide for a limited amount of therapy, whether it's occupational, physical, respiratory, or even speech therapy. They even have nutritionists, so if you have a specific concern that you want addressed, you might even ask about those disciplines early on. Hospice can and will provide durable medical equipment as well as oxygen. They may ask you what you need, but they may tell you what they're going to plan on supplying you. Do you need bilingual staff? You might consider looking at various hospice agencies in your area on an employer website, such as Indeed or Glassdoor. They should have a stable staff. If there's high turnover, that's a red flag. The staff can't take care of you if the company does not take care of them. Burnout is real. You may want to inquire about the availability of a volunteer to provide companionship. Learn their policy about you continuing to see your regular physician and how that's paid for. Is there assistance for inclement weather? Is that a concern you want to have addressed? Cover questions about communication between you, your family, your physician, and the hospice. Establish that the hospice will involve you in your care decisions, as well as medication changes, and that they're going to provide those updates to the leader of the family if needed. Now I'm going to delve into what's being done for you by the payers to reduce your risk of a poor hospice company. You don't need to do this type of investigation, but the information is there if you want it. I hope you're ready for this. It's a lot. There are many checks and balances in the system to protect you. Hospice agencies have to report on themselves and measure up to set standards. These tools are for payers to remove the low performers from business. Hospice is heavily regulated to ensure that you have access to excellent care and reduce your worry about selecting a bad hospice vendor. I am including a couple of internet sites. I'll put those web links in the description box below if you want to explore them, but it's not required. One of them is the Medicare Compare site. Then there's a couple of CMS sites, and then the Hospice Survey site. These websites post quality data and survey results on hospice agencies for everyone to see and use. These companies are required to obtain and report data to assist patients and families with selecting a hospice provider. One of these is the Hospice Care Index score. This helps payers and the government assess how well hospice scores on 10 quality indicators for care. This is nationally compared. Examples of some of these indicators include the amount and timing of skilled nursing visits, discharges followed by hospitalization, and the amount of spending per patient that's on hospice service receiving care. Hospices can earn 1 point for each one of these indicators. If they meet the criteria for that indicator, a total possible score of 10. You don't need to learn about these really or question the hospice about them, but just know they're in place and the hospice is being held to a high standard. That's how they get paid. A hospice agency must demonstrate those marks to be high on those quality measures or they're not going to be reimbursed. If a hospice does not provide the data to those payers, or if they don't fulfill one of those required care processes for a patient, the scores are affected and the agency can be heavily penalized, from 2 to 4% on every Medicare payment. Medicare typically is the primary payer source for most hospice patients, and that small amount adds up significantly to an agency. Each agency wants to receive the full payment amount, and it significantly stings them financially to be penalized. The penalties can be retroactive. If they're not meeting those requirements, they can suffer financially for more than 1 year. A comparison website is the medicare.gov/compare. This link, you can find information that agencies must report to Medicare and insurance companies with their star ratings. It also compares various agencies in a selected region. This particular site contains an excellent guide for you with suggested questions and considerations to assist you with your decision. You can look these over if you want, or print a copy of these questions. It will help you keep track of your findings of the various agencies. You can find the vendors in your area, get their contact information, and see their services compared side by side on the website. Now let's talk a little bit about the CAHPS information, and that's CAHPS. And so that's Consumer Assessment of Healthcare Providers and Systems. And this score is a survey filled out by families of prior patients that received service from a hospice agency. Know that this information has been provided by people that received care for a loved one. People just like you, with similar fears, needs, and expectations. The results of this survey are reported to the insurance companies as well as to CMS, Medicare. I cannot stress how important it is for you to take the questionnaire seriously when it's offered to you. Fill it out thoughtfully and completely so that others, when they're dealing with the most frightening journey that they've ever faced, will be able to see your comments. This is a journey that we will all walk. Go ahead and put the hospice agency on the spot. Ask the agency about their CAHPS score. See what they have to be proud of or what they're working on. Listen to what they want to share about their hospice survey scores. It's nearly 50 questions about the hospice service that was received by a patient from the family's point of view. You can find this information on the internet, but you can certainly request the information directly from the agency that you're considering. See if they are forthcoming to provide an internet link and how willing they are to review that information with you and explain it to you. Hospice is a business to care for people. They will want to help you understand all about them and earn your business as well as keep your trust so that you will be pleased with the service that they provide. Now a bit about hospice quality measures. Hospice actually has several quality measures called the Hospice Item Set, the HIS, and it covers topics such as treatment preferences, ensuring beliefs and values are being addressed, pain, screening, assessment and treatment, shortness of breath, evaluation and treatment, and bowel monitoring and treatment. This is a data collection tool that comes from Medicare. Hospice agencies that receive payment from Medicare are required to collect and submit this data on every patient, regardless of the payer source. As hospice is required to manage total pain, they must evaluate and treat for medical needs, social concerns, physical, emotional, and spiritual symptoms. Quality measures for hospice include the demographic information and specific information for payers to evaluate the success of an agency, and that's based on the management of anticipated symptoms. Changes are always occurring and the bar is always being moved up on these agencies, so they have to work really hard to provide high quality care or they're not going to remain in business. There are still more hospice quality measures. Hospice visits in the last days of life measures if a hospice provided sufficient care to patients and support for families and caregivers during the last days of life. Specifically, it measures the percentage of patients who are visited by a nurse or a medical social worker on at least 2 of the final 3 days of life. That's certainly a lot of data that's being collected and given to insurance companies on behalf of the patient. This is an effort to guard against poor service. Don't overthink it or take so much time making a decision that you delay your choice. Select an agency and try them out, knowing that you can make a change to a different company if you need to at a later date. In summary, the bar is set high for these companies. As you know, there are many regulations hospice has to meet. My goal has been to reassure you and reduce some of your concern about making a choice. There's way more information in here than what you need, but I want you to be confident that there are checks and balances in the system. I hope this gave you some ideas to keep in mind when you elect a hospice agency, so the worry of choosing should be decreased. I also want to remind you that if you accept hospice and you try it for a week or a month and you're not pleased, you can revoke. You can revoke the elected benefit and return to your prior type of aggressive care without penalty or repercussion. If you revoke because of a hospice service failure and you need to return to the hospital, you can accept hospice again at the time of discharge. They do want your business, and I can promise you their staff does care. Many of the hospice staff are as passionate, if not more so, than I am. Hospice is not viewed as glamorous, but it is a noble calling, and we are passionate about our compassion for the patient and the family. Comparing the hospices is important when making your choice, but don't get bogged down in the details. Hospice agencies are aware of, respectful of, and involved with your personal belief system. Confirming and observing the patient beliefs and values, asking and respecting patient treatment choices and preferences, pain assessment, evaluation, and treatment, shortness of breath symptoms, evaluation, and treatment, constipation evaluation and management, providing increased visits as needed when end of life nears, and supporting the patient and family through a change in the whole family dynamic. It's a very difficult transition in the life journey. Hospice is not a place. It is not to further curative attempts. It is not letting go of palliation or symptom management or quality of life. Hospice is not giving up. Hospice is not quitting, and hospice is not accepting death. Hospice is a service of highly trained and compassionate individuals. Hospice is a courageous choice, giving loved ones instructions regarding your beliefs and preferences that you want followed. Hospice is deciding in advance how you will meet your destiny, electing what environment for you is right in the last moments of life, deciding what quality of life means to you and saying so in advance. Hospice is being allowed to have a natural death with symptoms managed and comfort ensured, having support for you and your family, providing dignity, respect, and care at a difficult time. Hospice is healing when cure is no longer possible. I hope you are well and stay healthy. Live each day to the fullest and enjoy the highest quality of life. I appreciate your views and forwarding this to others that may benefit from the information. Leave a comment or question below, or if you prefer, send us an email. We really do like to hear from you. If there's something you want us to discuss, let us know. And thank you for giving us your time. Bye now.